quite often people think pharmacists are restricted to dispensaries and that their role is in just delivering the finished formulation of the medicine, as opposed to perhaps understanding that we get involved in all decisions made around medicines, from buying the medicine to assessing the formulation and the quality of the medicine when it comes in, to advising on the right dose of the medicine, the administration of the medicine for nursing staff, and monitoring the outcomes of the medicines as well. That's a particularly important role for us in terms of assessing whether the medication's been effective, whether it suits the patient's needs, whether it fits in with the patient's lifestyle, whether in fact we need to make some adjustments to that medicine. So it goes way beyond just the preparing of the final medicine that's handed out to the patient. As I say, the pharmacists also work in highly specialist areas as well, such as manufacturing, where they might be involved in preparing special liquid formulations of medicines, if such a formulation doesn't exist commercially, or they might also be involved in preparing intravenous injections, and certainly chemotherapy and intravenous feeding would be particularly important there. Many people think pharmacists are based in dispensaries, but actually increasingly, certainly in hospitals, pharmacists are based out on the wards, interacting with clinical teams, with nurses, with doctors, with patients and with parents. So they're at the front line of medicines use and interacting with the clinical team. That's not to say that we don't have pharmacists in dispensaries. Yes, we do. There are still a small proportion of pharmacists that will manage or oversee the medicines process in the dispensaries. There are also some pharmacists who work in specialist areas, such as aseptic production, where they make sterile injections, such as medicines which are given intravenously for our patients, or intravenous feeding solutions, or chemotherapy, which is used to treat cancer in our patients. There are also pharmacists who are based in specialist clinic areas, such as respiratory clinics or gastroenterology clinics, rheumatology clinics, intensive care facilities. And we also have pharmacists who work in our outpatient department as well, very much interacting with patients who are well, but coming to clinic perhaps for follow-up, and they would be involved in advising patients and parents on how to use and take their medicines. We work with a wide range of patients. Obviously, the population of children that come to the hospital are anything from birth to 18 years of age, and sometimes upwards of 18 years of age. So we have a wide variety of children and families that we're interacting with. Some of those children might well be quite well on the face of it. They're attending clinics for review of perhaps a chronic illness, or they may be, of course, acutely unwell and in our inpatient setting. So we're interacting across a whole range of different disease types, across a whole range of patient age groups, and across a whole range of family situations as well. Pharmacists have a contact with a wide range of healthcare professionals. Because we're based in so many different areas of the hospital, we would be interacting with doctors, clinicians, with nurses, with dietitians, with physiotherapists, very much embedded in multidisciplinary teams these days. So it's very common to find a pharmacist mixing with all range of healthcare professionals and providing input and support on use and administration of medicines. Many pharmacists would be involved in advising on medicines, and that would involve perhaps searching for the evidence behind using that medicine in a particular indication or a particular age group of patients. But increasingly we're seeing pharmacists now developing as non-medical prescribers in their own right. And certainly that's becoming very common in an adult practice and increasingly common in paediatric practice as well. So a number of pharmacists might specialise in a given clinical area and become a prescriber in that area. For example, things like chemotherapy prescribing might be done by pharmacists, prescribing of intravenous feeding solutions might be done by pharmacists. We have pharmacists who work in respiratory settings, pharmacists who work with our antimicrobial or antibiotic stewardship teams, who again would be independent prescribers. And I think any area where there is a specialty function and a specialty role for a pharmacist, increasingly now we're seeing those pharmacists develop prescribing roles. And that's consistent with recent reports that have come out on improving efficiencies in the NHS as well. So the Carter report, which came out in 2016, certainly talked about increasing the number of pharmacists who were frontline staff and working as prescribers. And that's what we're all aiming to do. I think one of the things that's particularly important is recognise the expertise that your pharmacist has, recognise their availability, and that's particularly important if you think about high street chemists, whether it's an independent pharmacist on the high street or whether it's one of the multiples such as Lloyd's or Boots or Rowlands or Well Pharmacy. Pharmacists are available, you don't need an appointment to see them, and they've got a wide expertise in medicines. If they can't help you directly, they can often signpost you to resources that will be helpful to you. I think the other point I would make is always be honest with any healthcare professional that you meet about the challenges that you might be having with medicines. Healthcare professionals are there to help people. We recognise when we work in paediatric pharmacy and the paediatric profession generally, just how difficult it can be to find medicines that children will accept. They're not always palatable to take, they're not always easy to take, they often don't fit in with people's lifestyles, for example, school, etc. And if people are honest about the difficulties that they face when taking medicines, then we're in a position to be able to support them and do something about that. But if you're not honest with us, we can't help you. I think it's also important for people to be aware that if they don't understand the information they're given when they're first given it, and often that is the case if people are given large amounts of information in one go, it's very easy to forget the detail that you've been provided with. I think it's very helpful if you recognise that, knowing that you can go and seek advice from healthcare professionals and they won't mind repeating the information or presenting the information to you in a different way that perhaps you will find easier and clearer to understand. And there are a whole range of healthcare professionals that you can go and ask. Community pharmacies on High Street, clearly very available and experts in medicines, but equally practice nurses, specialist nurses, GPs, and clearly the clinicians who look after you at the hospital as well. So I originally was attracted to pharmacy when I was 15 years old, which is going back some years now, but that was as a result of a careers talk that I had at school. And the main attraction was really the opportunity to interact with people and also to use my scientific background. So I was particularly interested in sciences, and yet I liked interaction with people, and pharmacy seemed the most perfect opportunity for me to combine both that interaction with people and also my scientific background.